Good evening, my name is Sophia Matavu and you're watching UHealth Chat, sponsored by National Medical Stores, who are mandated to procure and distribute medicines to government-owned facilities all over the country. Now, January is Cervical Cancer Awareness Month, and cervical cancer is one of the cancers that is highest and the leading cause of death in women. Now, with me in studio to talk about what you should know about cervical cancer is none other than Dr. Noleb Mugisha, who is in charge of Comprehensive Community Cancer Program at the Uganda Cancer Institute. Dr. Noleb, good evening to you.
Good evening, Sophia.
How are you?
Fine, fine.
Okay. Now, how is the Cancer Institute?
The Cancer Institute is fine. Despite what is happening, you know, the economy, but we are well. We are providing services. We are making improvements. If you do visit us one of these days, you'll be impressed.
Okay, that's
yes,
nice.
You will.
Now, I don't take it for granted that when we talk about some of these bits or our anatomy, people get to know what we're talking about. To start with, I'll ask the usual cliche question. What is the cervix?
Okay. So, and it's important that our viewers know, because when we talk about cancers, you know, some people think cancer is one disease, but cancer is a group of diseases, and they are named according to where they start, you know. So the cervix is the lowermost part of the uterus. The uterus, other people call it the womb, where the baby, where a mother carries the baby from. So, and our viewers also need to know that it's only women who have the cervix. So once again, sometimes we say it's the mouth of the uterus, or it's the lowermost part of the uterus. So usually when we want to look at the cervix, we go through the vagina. Because when you talk about the uterus, people may think, do you have to open, you know, a mother? But, you know, it's the lowermost that one can see. When they put a spectrum in the vagina, they are able to visualize the cervix as a ring. Yes.
Of course, we shall be taking a look as we continue this discussion. We will be aided with a little bit of clips of pictures here and there for somebody to get an actual visual of what we're talking about to understand. Now, what is cervical cancer? And then, of course, is obviously that part that's affected.
Yes, yes.
Okay. What are the statistics of cervical cancer in Uganda?
So I think I should start by telling you that cervical cancer is the commonest cancer in women in Uganda, and also the commonest of all cancers. So, and that's important for our viewers to appreciate, that it's the commonest cancer in Uganda. So every year we have over 2,700 women.
Every year?
Every year.
2,700
women developing cancer of the cervix. That's a huge number.
Wow.
And you know, now the percentage of those who have advanced cancer has reduced. We have about 50% of them presenting with advanced cancer. And as we go through this conversation, I'll be explaining what I mean by advanced. But we again lose about 2,500. So we lose many to cancer of the cervix every year. But this proportion again is reducing because many women are presenting for cervical cancer screening. They are being identified early, and they are coming when the cancer is early. And it's a great achievement when we look at our statistics, because about 10 years ago, 80% or even more than 85% of women with cancer of the cervix were presenting with advanced cancer of the cervix. But now about half, present with advanced cancer of the cervix.
Now you really worry me. Okay, what we're seeing right now, okay, Dr. Noleb, what you're seeing on screen right now, is that what we're talking about when you talk about it looks like a ring-like shape? Yes.
So when you look at the cervix from the vagina, from the lower end, because it sort of, remember, the uterus is like a pocket where the baby grows. So the outlet where the baby comes out, when it's not open, it actually looks like a closed ring with a space in the middle that is pink in color. But that's usually the entrance, what we call the orifice, or we call it cervical os, the entrance into the uterus. But when somebody puts a spectrum and they look at it, they actually see a pink ring with a red or deep pink spot in the middle, because you usually don't see sort of the opening, it's closed. Yeah. Now when we are examining, that's what we are looking for. Because that's the part on a woman that commonly develops cancer in this country.
The opening.
That lowermost part, which is, we call it the mouth, not the opening.
The opening, the opening.
Yeah. So the ring is the one that develops the cancer. So when we are examining and we visualize it, then we apply acetic acid, where we are using visual inspection with acetic acid. We apply acetic acid on the whole ring, and then we observe for changes that are going to be indicators to us that the cancer process is beginning. And these changes usually, this really is a preserve for health workers, but what we usually look for, they're sort of whitish flakes, or like whitish patches. They are whitish cream patches on the ring. Yeah? And they usually begin from what we call a squamocolumnar junction, but again, this is anatomical language. But for our viewers to appreciate, is that when we put acetic acid is not painful, but it sort of can cause like a sting, kind of, the woman will feel a difference, not pain. It's just the way, because acetic acid is, it's like if you put lemon in your mouth, that
tanginess.
Yes.
A feeling.
But of course, when it's on the cervix, it's not like on your tongue. But to give a sense that it's not a painful procedure, but it stings for a very, like 30 seconds. And then the woman will feel normal. Now, in 1 minute, we observe for those changes. And if they are there, then we say this screening test is positive. If they are not there, then we say the screening test is negative. So it's as simple as that. And the whole procedure takes about 5 minutes. Okay. I know there are many women who fear. The moment you say go in for cervical screening, they say,
they fear the most, I think, is the discomfort of the instrument that is used to be able to access and to get to the opening of the cervix.
Yes. And the beauty about it is that when we get this instrument, we apply KY jelly to make it smooth. So the entrance in the hands of a skilled health worker is really, of course, it's not comfortable, but it's not painful. It's, of course, it's uncomfortable for anyone, to have their private area being examined. But the importance is that we are trying to look for a cancer that is the commonest. And when cervical cancer is diagnosed late, then the outcome is very, very poor. Yet, if we catch it in the precancer phase, what I said, the cancer process is beginning, we are able to cure it. And this woman will actually die of other things,
Now, let's get to the point. What are the causes of cervical cancer?
So, again, I want to, sort of clarify this to our viewers. When it comes to cancer, we do not mention causes, interestingly, or should I say, not unfortunately, but cervical cancer, like all other cancers, has what we call risk factors. Now, these risk factors to an ordinary person, you could call them causes for them to relate them with a disease and be able to say, if I do this, I will get this disease. But technically speaking, they are not causes. We call them risk factors. So risk factor number 1 for cancer of the cervix is infection with human papillomavirus. Because 99% of all cancers of the cervix are associated with human papillomavirus. And our viewers, many of them have had what we call HPV, because HPV is a short form or an abbreviation for human papillomavirus. Now, this is the virus that we are vaccinating against. And it's important that our viewers know. That's why we as I come down, I will be sort of associating the other risk factors with the virus, you know, acquiring the virus. So risk factor number 2, risk factor number 2. Now I want to talk about the risk factors that are not biological. Yeah, risk factor number 2 in this case will be immune suppression. Immune suppression is where somebody's immunity or the ability of the body to fight disease is weakened by either another disease or by, you know, a different situation or circumstance. So for the purposes of cancer of the cervix, the biggest immune suppressing agent that we know about is HIV infection. So when a woman has an HIV infection, their immunity is suppressed, and that increases their risk for developing cancer of the cervix. And then the other risk factor is tobacco use, specifically smoking. It's a big risk factor for cervical cancer. Now, tobacco use amongst women in Uganda is not very highly prevalent. So in our setting, it's not a big risk factor, but biologically and scientifically speaking, it's a risk factor. Now, the other risk factors that our viewers need to know is early onset of sexual activity. So women who start sexual activity when they are young, and evidence has shown us that girls, young ladies who start sexual activity before the age of 17, their risk of developing cancer of the cervix is 3 times those who begin beyond the age of 20.
Oh, wow.
Meaning that when they get infected with this virus, the risk of the virus eventually leading to the changes that lead to cancer of the cervix is higher than if they acquire the virus when they are old. And our viewers need to know that. So that's why we encourage young girls to delay their sexual activity. I usually recommend until when they get married, but I usually say if you want to engage in sexual activity before you get married, then the fewer the sexual partners, the better. And that leads me now to another risk factor, multiple sexual partners. And I want our viewers to remember that when somebody has many sexual partners, the risk or the chances or the danger of catching the virus is higher than if they have one. So the more the sexual partners, the greater the risk of catching the human papillomavirus, which eventually leads to cancer of the cervix. And I should also say another risk factor that we observe in clinical practice as we assess patients is many children. You know, mothers who have delivered many children. But of course, if somebody has 16 children, then you know they either have more than one sexual partner or they have had these multiple sexual encounters, which increases their risk. So this is sort of, we should say it's an association, not really a risk factor, but I must mention it that the more the children, the higher the risk of developing cervical cancer. But I am relating it with the risk of acquiring HPV because of the other factors associated with having many children. Another risk factor, unfortunately, in our setting is actually poor socio-economic status.
Wait a
Now,
minute.
we observe this. The reason here is very simple, is that if a woman is poor, they are likely to be at a disadvantage in choosing the kind of lifestyle they live.
Oh, yes.
You know? And so, again, cancer of the cervix. If you came to the Uganda Cancer Institute, majority of our patients are actually, they belong to the lower social class. Yeah? And if you think about the way, you know, we choose our lifestyles, then you know that the socio-economic status has a big influence. And more so when it comes to a woman negotiating for the kind of sexual relationship they want to engage in. So that is also another important factor to know, particularly for our leaders and for people like me and you, that we should remember, if we have a chance to protect the women from the lower socio-economic status, then we should make use of that chance.
Okay, and then what are the signs and symptoms? How does one identify?
Yes.
Because if you realize, most times most people present at the late stage.
Yes.
When it's already, they might have had these issues happening to them normally, but they do not get to realize or to get indicators and pointers, especially when it comes to bleeding, that this is what it is communicating.
Yeah, so I must mention here that as it is the case with all cancers, cancer of the cervix has no signs, has no symptoms when it starts. By the time a woman, you know, presents with signs and symptoms, the cancer is most likely advanced. But then we must mention the symptoms. That's why we appeal to all women to present themselves for screening for cancer of the cervix. That's why I labored at the beginning to explain that really the screening procedure is not painful, it doesn't take a long time, and I want to emphasize that we've trained many health workers now in screening for cancer of the cervix, so many health facilities now can provide the service. I must say that at Uganda Cancer Institute we do this on a daily basis, Monday to Friday, for free. And you know, we do the screening for free, we do the testing for free, we present the results for free, we treat the cancer for free. So really, if anyone lives within the Kampala area, there is totally no reason for them to present with advanced cancer of the cervix. But what are the signs? So the commonest sign that women are likely to notice is, I would call it spotting. You know, they notice blood when they don't expect it coming from their vagina. Vaginal bleeding. Now, not early in the disease process, but early in their experience of these symptoms,
Of the cycle.
they are likely to see it after any contact. Either they are cleaning themselves, or they have had vaginal sexual intercourse and they see the blood, or it's just intermenstrual. They don't expect their periods and they see blood. Now, I want our viewers to note that this is not accompanied with pain. They see the blood, and sometimes they see a spotting, the next day there's nothing. And many of those who will receive, they see a spotting, say then 1 month later they see it again and they brush it off. Another 2 months they see it again, they brush it off. Meanwhile, the cancer is progressing. Yes. So that's one important factor that all women should look out for. So if a woman sees blood when they are not in their periods, they see blood after any contact, it could be intercourse, sexual intercourse, it could be cleaning themselves, or they see blood after menopause. You know, some women can have, you know, an episode of bleeding from their uterus that is not to do with cervical cancer, maybe 2 years after their menopause. But any bleeding, vaginal bleeding after menopause, is a high risk factor. Is a red flag sign for a potential cancer of the cervix, and all our viewers should really appreciate that. And I must emphasize that when we notice this, we should present ourselves to a healthcare worker. And again, you don't have to go all the way to Uganda Cancer Institute. Any health unit you go to, you know, you will be guided on what to do next. Now, the next sign that is likely to appear could be maybe a discharge from the vagina. Usually it's foul smelling, it's blood stained or brown looking, but this usually comes late. And again, I want to emphasize that early in the disease, the signs are very, very rare, and that's why patients usually present with advanced cancer of the cervix. But I must emphasize, screening is available, it's free of charge in many of our government health facilities, it takes a short time, it's not painful, and it saves many lives. Now, another sign could be, there's what we call
Dodging.
Dodging. There's what we call like a vaginal rectal fistula, where the cancer eats, through the vaginal wall and erodes into the rectum, and then the woman sees
like
stool coming through, their vagina, but that is really, really usually late. Many times these women will have come because of the offensive discharge from their vagina. Usually that's what brings women. Yeah. Of course, also early in the disease, they can have pain during sexual intercourse, but this is usually not a dependable sign because it's likely to come late. So I must emphasize again, if you're sexually active, you're 25 years and above, present yourself for cervical cancer screening. Yes.
Now, when you talk about the screening, what's the difference? Because there is a time when, yes, the screening is just within 5 minutes. Then you'll see that there are certain scenarios where somebody has gone through the screening and they refer them to the next level. I don't know how that particular first stage of screening is called, where they just use that acetic acid. Then they tell somebody, go for a pap smear.
Okay. So this is what we do in Uganda. We use acetic acid for women who are 25 years to 49 years of age. And in a moment I'll explain why. Because the acetic acid that we use, the cervical changes that we are looking for depend on what we call a squamocolumnar junction of the cervix. So the cervical cancer development process starts within the squamocolumnar junction. So this is the part of the cervix which has the new cells. It's part of the cervix that has, it's a transitional layer of the cervix, which has the old cells that are, it's the new cells that are coming from inside the cervix, like as you enter through that orifice, you're going into the uterus. So the cervix, the cells between the actual surface of the cervix, which are squamous cells, and then the cells which are inside the inside the canal of the cervix, or if you went inside and you go inside, they are columnar cells. So on the surface they are squamous cells, on the inside they are columnar cells. Now in between there is a zone where cancer of the cervix starts. Now when cancer of the cervix starts there, we apply acetic acid, and then when the cells have begun changing, those are the ones that change and look whitish. And that's why we use acetic acid in women who are 25 years to 49, because the squamocolumnar junction is not visible in girls before they are 25 years of age, majority of them. And then in women who are 49 years and above, this squamocolumnar junction has disappeared.
Okay.
And so if you use acetic acid, it will not give you the results you're looking for. And so for women who are 49 years and above, we do a pap smear. Now for women who are below 25 years, usually cancer of the cervix is rare in that group. But I can't say they will not suffer from cancer of the cervix. They do suffer from it. For them, we'll do a spectrum exam and we'll observe and see. And if the cancer of the cervix is beginning, we should be able to observe changes. But usually if they are 23, 24, we want them to attain the age of 25, then we screen them. If they have any complaint of vaginal bleeding or a discharge, we examine them to make a diagnosis of what is causing their symptoms. Now, after we've done the initial screening, either we've done VIA, visual inspection with acetic acid, that is the main, the main method we are using for the majority of our women. When we find it positive, then we have got to do a biopsy. Now, at the biopsy is where we do a colposcopy. We put in a colposcope, we use a colposcope which magnifies what we are seeing, and then we are able to pick a biopsy from there. So this biopsy, we are picking tissue, or we are picking, what in Uganda people call akanyama.
Akanyama.
Yes, that we now take to the pathologist to confirm that actually the changes we saw are cancer, or they are still in the pre-cancer phase. So cancer of the cervix has an advantage in its process, that the cervix first goes through the precancerous phase, which we call carcinoma in situ. Yes, which we call CIN, which can resolve on its own.
Resolve on its own?
Yes. CIN1 usually over 80%, actually 85% of the women resolve on their own. CIN2, the ones that resolve on their own, probably about 70%. CIN3, about 30% are likely to progress into cancer. So we usually want to screen women and catch the cervix when it's still in this phase. Because this phase we can treat it and cure it, and the woman will not have to develop cancer of the cervix.
Oh, wow.
That is why screening for cancer of the cervix actually prevents cancer of the cervix.
You have emphasized that several times, that I think at this particular time,
because I wish that all our viewers can actually present themselves for screening, because it's the golden tool we have to really reverse the statistics of cervical cancer. Because if you look at the statistics for the developed countries, it's not even among the top 10.
But here it is among the top 10.
No, it's number one, not even top 10.
Number one.
Yes.
Okay, at this particular point, I would like us to get into a very short commercial break for about 2 minutes. Then when we get back, we are still going to continue with this topic of discussion. It is Cervical Cancer Awareness Month.
A good school doesn't tolerate violence against children.
Because a good school equals a better life.
Raising voices.
The Ministry of Health reminds the public that Ebola is real and we must do whatever is required to prevent getting new cases. We therefore encourage everyone to remain vigilant and not to relax on Ebola. The symptoms of Ebola include sudden onset of fever, severe headache, muscle pain, weakness, sore throat, vomiting, bloody diarrhea, and in some cases, bleeding from the body openings. Please seek medical help from your nearest health center if you detect any Ebola symptoms. The sooner you start treatment, the higher your chances of survival. Please inform your nearest health center if you identify anyone with such symptoms. To prevent Ebola from spreading, follow the Ministry of Health and World Health Organization guidelines on Ebola. Wash your hands regularly with clean water and soap. Ensure safe and dignified burials of Ebola victims. Avoid handshaking and hugging. For more information on what you need to know and do concerning Ebola, please call toll-free 0800 100 066 or SMS 8500.
This message is brought to you by the Ministry of Health with support from the United Nations Development Programme, UNDP, and in partnership with the Interreligious Council of Uganda, Buganda Kingdom and Kampala Capital City Authority.
Welcome back from that short break. You're still watching You Health Chat, proudly sponsored by National Medical Stores. Now, like I said before we went for the break, what you need to know about cancer. Since this is the cervical cancer awareness month, why don't we tell it to you all? And Dr. Noleb has been emphasizing a lot about screening. Now, Dr. Noleb, just briefly, how often should a woman screen?
That's a good one. So a woman should screen every 3 years. We were actually recommending every year for people with HIV, but now the recommendation has changed. Every 3 years, all women, because there's enough evidence that we don't have to over-screen women with HIV anymore. So any woman of reproductive age, 25 years and above, should present themselves for screening. Usually when a woman comes for screening, then we tell them when to come again. But for the purposes of our viewers, we screen women every 3 years for cancer of the cervix.
And screening is for free.
And screening is for free in many hospitals.
Even the pap smear?
Yes, that's a very good one. One of the reasons why we prefer using visual inspection with acetic acid VIA is because the interpretation of the VIA happens there and then.
Oh, yeah.
You know, the health workers applies acetic acid and tells you positive or negative. Now, I want to remind you, if they screen and say positive, it doesn't mean there is cancer. It means the screening test is positive. Now, it means that then we need to do additional tests to confirm whether indeed there is cancer or not. And this is important for our viewers, because there are many people after they have been screened and they say they are positive,
that is it.
They say, I have cancer. No, that's not true. All screening tests, when they come out positive, it means that there could be cancer, but there's also a possibility there's no cancer. And for the pap smear, correcting the pap is for free. At Uganda Cancer Institute, for instance, we don't charge for a pap smear. We correct a smear for free. We also do the laboratory test for free. But in other settings where they correct the pap, they may take it to a laboratory where the patient will have to pay. But I want to tell our viewers that actually Uganda Cancer Institute receives samples from across the country. So if you went and you have your pap smear done somewhere in a private clinic, you know, you do yourself good to let them know, I know that at Uganda Cancer Institute can be done for free. You know, so that you benefit from the investment the government has made. Yeah, that's very, very important. And I want to emphasize that when we find VIA positive, we can actually do the treatment there. You know, we do either cryotherapy, where we freeze the lesion, or we do thermal ablation, where we use you know, some kind of electric heat to sort of make sure that lesion, that those cells that have changed, we remove them. Yeah, and this is curative. This reverses the process of this cervix turning into, you know, developing an invasive cancer.
Those are treatments we have here.
Yes, we do. That's why I'm saying that screening is really a great tool. That if all women in Uganda were screened, I must tell you that we could reduce the deaths to cancer of the cervix by 80%. Even if we screened all of them just once, you know, because when we identify the positive, we treat it, and then we review this woman after 3 months, after another 3 months, and the healing process is complete. They are good to go. Though it doesn't mean that that woman who has been treated should not be screened again. No, we continue screening them again every 3 years, but many times if we screen and we treat them, you know, usually many of them don't develop any other lesions thereafter.
At what stage? Because there are certain times out there in the public, the women are like, the best treatment for cervical cancer is to remove the entire uterus.
Yes, now that treatment I have talked about is for CIN, which is cervical intraepithelial neoplasm. CIN is a precancer phase. that's the one that is treated in the screening room. Now, if we take off a biopsy and we confirm there is what we call invasive cervical cancer, then the treatment depends on the stage. Cervical cancer, like other cancers, has stage 1, 2, 3, and 4. Now, stage 1 is really a very early stage, and it can be treated and cured. Stage 1, 2A can also be treated and cured. Even 2B, majority of the women can be cured. I'm talking about treating you once and you're cured. You know, that's why screening really becomes very, very important. Now, stage 3 and 4, we may not cure them, but we can actually, you know, prolong their symptom-free life. I know many women who came with stage 4, 8 years down the road, they are okay. I know one woman I know very well who is raising her grandchildren, and we treated her 10 years ago. Stage 4, cancer of the cervix. So now, going through the treatments is very, very, very difficult because it may actually, the viewers may get, they may misperceive. But when it's, the stage determines the treatment. Now, one of the treatment methods is to remove the uterus. But we remove the uterus where the cancer has reached a stage where the uterus really cannot stay. Because remember, it's a cancer of the cervix, but the cervix is part of the uterus. So as it advances, it continues to invade the uterus. So at some point, you've got to remove the entire uterus. And so when it's already invasive cancer, the best treatment is to remove the uterus. Well knowing that this uterus that already has cancer is not useful. It's only harmful. Yeah? And then after we've removed the uterus, in many cases, we add radiotherapy, where we subject this part that had cancer to high energy radiation to destroy the cancer cells that could have remained. But for cervical cancer, we usually do what we call chemoradiation. We give an injection of chemotherapy and then give radiotherapy. The chemotherapy or the cancer drugs, we call them radiosensitizers. They sort of make the cells respond to radiation much better. So they improve the benefit for the patient. So we have surgery where we remove the uterus. No. We have where we just use cryotherapies, thermoablation to treat the precancer phase, which is really the phase we want to catch, and we treat. And then we have surgery where we remove the uterus. Now, in treatment of cancer of the cervix, there's nothing like removing part of the uterus.
It has to be the whole uterus.
It has to be the whole. Because remember, it's the uterus that is affected. Yeah? And then after that, there's radiotherapy, which in our case at Uganda Cancer Institute, we do chemoradiation. So those are three treatment, those are like three kind of approaches for precancer: surgery, radiotherapy. Now, after we've treated a woman for cancer of the cervix, we have got to follow them up for the rest of their lives. And I want our viewers to hear this. Why we follow up patients we treat for cancer for the rest of their lives is because we want them to have opportunity to be screened for other cancers. But also we want, in case the cancer we treated comes back, or there was something that remained, because sometimes you treat the cancer and there's a state we call a stable state. Like the cancer cells sort of go to sleep, and after some time they begin to multiply again. So we want to make sure that we are following up these patients so that if this happens, we are able to catch it early and treat them so that the cancer we treated doesn't come again and, you know, take their lives.
Oh, wow.
Yes.
Then how do you manage if a patient starts feeling overwhelmed, distressed, and, you know, depressed? There's certain times the whole process of going through it.
Yes.
You can just tell and feel like we've had stories, and people just imagine the thing I think that freaks them out the most, the term chemotherapy.
Yes. Now it's Sophie, I think one day you should you should give me opportunity to bring a cancer survivor and they tell you when they went through chemotherapy. The truth of the matter is chemotherapy can have very, very severe side effects. You know, it can, patients on chemotherapy can lose their hair, their nails turn and become black. You know, some people, chemotherapy will make them vomit, it will make them have diarrhea. But particularly the chemotherapy we use for cancer of the cervix doesn't have those severe side effects. You know, when we give it in combination with radiotherapy, it usually doesn't have those severe side effects. But even those who get severe side effects or very extreme side effects, they are short term. You know, the moment they complete the treatment, the hair grows, the nails become normal, they live a normal life. So it's intensive, yes, and I cannot brush it off that it's not sort of emotionally exhausting, even physically exhausting, but it's worth it's worth the braving, and you go through it, and a woman goes through it. Now I want to emphasize here that cancer treatment in general is a multidisciplinary activity. It's a multidisciplinary service. It's very, very, very difficult to give cancer treatment in a small clinic somewhere in Kampala City. One doctor, you know, you got to have a team. At Uganda Cancer Institute, you know, you'll see an oncologist, when you read radiotherapy, you see a radiation oncologist, we have counselors, we have a palliative care team, because sometimes the pain is extreme, the symptoms are extreme, and you need someone to counsel and give medication to control symptoms. So usually when patients are overwhelmed, I agree, there are many patients are overwhelmed, but we have counselors, we have a team that can really, you know, counsel them, and they are able to gather themselves and brave. You know, I was told in the 70s they used to call chemotherapy Saba Saba. You know, and the bottom line is that there are patients who, even when they, 1 week before they come for their chemo, they begin vomiting, they begin feeling as though they have received chemotherapy because of the psychological effect. But the good news is when they complete their treatment, everything returns to normal. Yeah, so there is, it's just like labor pains. I'm sure mothers who have delivered, you know, they want to dread the labor pains, but they go in knowing that when these pains are over, there is joy of carrying the baby.
Okay.
Yes.
Then a final one from me, Dr. Noleb, just very briefly. What are the options? Because, you know, there are rumors where some people will actually say they have used herbs and have been able to get cured of cancer. How true or false is this? Now,
I don't want to claim to be a herbalist, but as a medical doctor, I want to tell our viewers, herbs do have a role. And we've seen patients who have used herbs to treat cancer, and you see there is a difference before they used herbs and when they have used herbs, for some of them. But I haven't seen a patient who has recovered as a result of using herbs only. So I want our viewers to know that the other unfortunate thing when it comes to herbs in Uganda is that there isn't enough research on the herbs to know what dose, at what frequency, for how long, you know. And I usually want to encourage those who want to know more about herbs. We even advise herbalists to approach the Uganda Natural Chemotherapeutics. I think they have their offices in Kamocha. They are the government body that is mandated to do research on herbs and be able to make sure they are safe, because some herbs will be poisonous, you know, to make sure they are safe, but also know how to package them in order for people to benefit from them. You know, what dosage, at what frequency, for how long. Yes.
Okay.
Yes.
Well, thank you so much, Dr. Noleb. Your final winding up remark to a person who is watching you right now.
Okay, great. So I want my final remark about cancer of the cervix is that for women who are sexually active, please come for screening. present yourself for screening. Another final remark is we need to make sure we vaccinate all girls who are 13 years against cancer of the cervix. We vaccinate against human papilloma virus, but the vaccination prevents cancer of the cervix. And the aim for the vaccination is really to prevent cancer of the cervix. But the target that we are targeting is human papilloma virus. This vaccination protects 70% of the women if we vaccinate them when they are girls. Thank you very much.
Thank you so much, Dr. Noleb, for your time and for sharing very, very educative information. To the ladies out there, I don't think I need to echo it out again. Dr. Noleb has emphasized the importance of screening. What better way to say it? If you have never been screened and you're 25 years and above, it's a time now. The screening takes place at Uganda Cancer Institute for free. And then also, I think it's in the month of October that you will find that most big health facilities are doing screening for free. So make an effort as a lady to go and have yourself checked for cervical cancer. Well, that is all we had time for tonight. I'd like to say good night from me and Dr. Noleb. It is just about 6 minutes to the top of the hour, and Rhoda Ngonzi is going to come your way shortly with a 10 o'clock bulletin. Good night.
UBC